This is part 2. You should also listen to the really short part 1. Some quick background. This review is about Dr. Dhar, so the background only has key points. In 2013, I was harmed by an MRI tech who did an illegal action with an injection. Something similar to those curiosities online as to how to kill someone with an injection. I was unconscious for an hour but survived with some severe injuries to the circulatory system. MRI techs are really good professionals, and this guy is just an aberration. When I returned to the neurologist in Virginia that ordered the test, she didn't want to be bothered, so she deleted the order from the records, changed the topic, and began to treat for migraines that her own records said resolved in 2005. She prescribed verapamil, a heart drug, and that made the injuries worse, then concealed everything, and some months later a dentist gave the standard local nerve block, and he did nothing wrong, but those earlier injuries became worse. So I showed up for my first visit with Dr. Dhar as a Medicaid patient in October of 2014, and now the insurance plan that I had assigned the Medicaid, they assigned me to her, and it wasn't my choice. When the taxpayer pays the bills, there are many laws for a doctor to follow. One is that she's not to have an agenda, but Dr. Dhar did. She was doing the dirty work of the doctors who harmed me. Another notable violation is that Dr. Dhar defrauded Medicaid. The signs of my injuries were primarily on the head, neck, arms, and chest. She limited the physical exam to checking the eyes, ears, nose, and mouth. Everything else she fabricated. She never touched my chest or used a stethoscope, yet claimed that heart and lung sounds were normal. They have you get a true, complete physical, and they ask you to be in your boxers. I had some sweatshirts on, and I was going to decline that true physical. But Dr. Dhar never even asked. She wrote in the records that she completed those checks when she did no such thing. She saw in my records that I had a serious problem with the upper spine, but she had me sit on the exam table back unsupported for 45 minutes. She conducted no physical exam and was hard at work deflecting my attempts to give any medical history. Her mind was so focused on doing the dirty work of the other doctors that she did not realize that if all she was going to do is debate the patient for 45 minutes, then she should have asked him to get dressed. She already had the advantage of being a physician in a debate on medical matters with the patient. Now on top of that, I have to do it wearing a pair of shorts. Dr. Dhar was scheming on the fly. I was free to go at the end of the visit, but just before leaving the office, an employee told me that Dr. Dhar wanted to have my blood drawn and also to have an ECG of the heart. It's noteworthy that Dr. Dhar never touched my chest during the visit, but the employee had to do that for the ECG. From her agenda, that makes sense because my cardiovascular problems don't register any abnormalities on an ECG, but they do for a physical exam. So Dr. Dhar needs to return the fee to Medicaid, because she's not right. It's not right that she keeps that fee when she did not provide that service. Now the main harm to me is her awful medical records. It makes no note of the ECG. It fails to note the heart rate. It says that the patient denies fever, yet her employee took my temperature and it shows 99.7 on the records, and my records from my other physician showed that my normal is 98. So I was easily presenting with a fever. This fever and the related hoarse throat was present for more than a month, and I had to visit Medstar Prompt Care Wheaton for the same problem that Dr. Dhar was supposed to treat earlier. And the records from Prompt Care and the Prompt Care records And so I got the records from prompt care, and I got the records from Dr. Dhar, and the prompt care records show that Dr. Dhar was basically trying to kill me, and there's no paranoia or exaggeration. Now what you need to do is you need to look up the issue of an aneurysm of the ascending aorta, and you'll find the story of the actor John Ritter. He had an aneurysm identical to mine, and he died 2 years after that. Now when he went to the ER, they confused it for a heart attack, and that killed him. This should have been the top item on the problem list on my medical records. The other condition was to be superior vena cava syndrome, and that should have been number 2, because although it's not going to cause any kind of long-term harm, it explains much of my symptoms and my difficulty in driving and such. But anyway, neither one of these diagnoses appear, and instead what Dr. Dhar puts on my record is 10 items, 10 diagnoses, and 3 of them are legit. There is some shortness of breath, some sweating, and the upper spine issues. But even these are relatively minor compared to the majors which were supposed to be there. Now the problem list is actually for listing the most severe and chronic diagnoses. So at least in John Ritter's case, the issues were mainly of ignorance, incompetence, and that John Ritter actually had all the risk factors for a heart attack. His arteries were in fact severely clogged. In my case, a CT from the radiologist declares that my aortic aneurysm is very unusual because my heart looks great and my arteries have less calcification than 100% of men my age, and I have no risk for a heart attack. Dr. Dhar cunningly created a problem list that makes it appear that I am at a great risk of a heart attack. The first problem listed is obesity. Now, how can a middle-aged man have no calcification in his coronary arteries when he is obese? Dr. Dhar knows that my 40 pounds of additional weight is from edema, which is fluid that is swelling of the upper body, which comes from problems with the circulatory system. And she knows that her own employee who weighed me was trying to adjust the scale for a measurement at about 160 pounds, and she was surprised to find that I was actually weighing 205 because much of this weight is not even seen. Okay, the number 2 diagnosis she has for me is a family history of ischemic heart disease. Dr. Dhar and I had a long discussion, while I was in my underwear, and that there is no genetic predisposition to a heart attack. My father had a heart attack at age 54, but today he is fine at age 77. He only had the problem because of a poor diet and no exercise. Both his parents lived into the 90s. Into their 90s. Dr. Dhar is such a crook that on the records that she gave me, she did not note this diagnosis. Then after giving me the records, she went back and added it. That's why I found it when I went to Medstar prompt care. Now, the third diagnosis is high cholesterol, but she knows that also, although the LDL was just a slightly bit elevated, the LDL-HDL ratio was fine. And I also had a good explanation for this slight elevation. And the number 4 problem, which she noted, was high sugar. That was also slightly elevated because those other demons who injured my circulatories, because of the issues caused by those demons who injured my circulatory system, I now need to snack on like semi-junk food like oatmeal raisin cookies and fig bars throughout the day to at least somewhat compensate for the problems. And then she writes on the patient instructions that she advised patient to limit fat intake, advised him to lose weight, and recommendations regarding diet and exercise were discussed. All bull, all lies. She didn't know such thing. Then the number 7 diagnosis is headache. And during the visit, I made it very clear to Dr. Dhar that I hardly ever had headaches. This was another one that she did not list on the records. She gave to me and then added it in later. Recall that the neurologist who changed the subject and treated for migraines from 2005, the neurologist who, if you in in 2013 changed the subject and treated me for migraines, which I hadn't had since 2005, and that treatment harmed me. So now Dr. Dhar wants to cover up for that other doctor by saying that I have headaches and that treatment was warranted. Then the number 9 diagnosis is hand numbness. That's another one which Dr. Dhar did not include in the record that she gave me and then later added to the system. This also while I was in my underwear. Dr. Dhar and I had an extensive. Now, this also while I was in my underwear, Dr. Dhar and I, we both had an extensive discussion. I made it very clear that especially at night, most problematically while I drive, there is a great numbness and dizziness in the head and some numbness in the arms. But Dr. Dhar tried to call it carpal tunnel syndrome of the hands, and I made it clear that she has my CT and vascular sonogram showing all sorts of problems with my circulatory system, the major arteries and veins in the arms, chest, neck, and head. She asked me, why does it have to be because of that? She would not even name what that was. So if I appear at the ER with the chest pains caused by the aneurysm in the ascending aorta, Dr. Dhar's records will cause the ER to treat for a heart attack instead. That even if I protest at the ER, that would not change things because Dr. Dhar did another thing to make sure that I stay buried. She gives a false narrative in the patient history section. She is presenting me as either a hypochondriac or a liar or both. She says that the patient has had extensive evaluations for a variety of neurological symptoms in the past with Dr. Body at Johns Hopkins, Dr. Jaitley, and with Dr. Kulkarni. It is well known that malangerers, the liars, who they make up neurological symptoms because many times those symptoms cannot be observed. And then there are patients with psychological conditions which are truly, where they truly do feel non-existent neurological symptoms. It can be said that MS is actually depression, just that the patient is in denial. Anyway, my history was unlike these other patients. I have a lot of evidence and I hardly ever went to a doctor. Dr. Body at Johns Hopkins was an ENT, and in 2000 I was being evaluated for sinusitis. But Dr. Dhar tells a lie that I had extensive evaluation by the Hopkins neurology department. Dr. Jaitley in 2003 treated for migraines without anything more than a standard neurological physical exam. Then for 10 years there is no interaction with another doctor. What kind of hypochondria is that? In 2013, Dr. Kulkarni did nothing more than that routine physical exam, and then she harmed me. And the MRI tech did a MRI which harmed me with an injection into an artery using an injection line, using an extension line, an infinite dose, and with great force, so great that the materials were sent in reverse up to the brain and the heart. Now those actions of that MRI tech, Dr. Dhar is asking me why I did not take anyone with me to that test, blaming the victim, inferring that I did something wrong by not having someone with me. This is a simple MRI injection. You don't need a chaperone. I had a state disability form to collect $185 per month, and I told Dr. Dhar to hold on to it and fill it out after my referral to the cardiologist was finished. So I did not say fill it out right now. Dr. Dhar undid the staples and gave the form back to me, saying that she will never fill out the form for me. This is a welfare doctor who would not have a job, be it not for Medicaid, and she collects even fraudulently a large slab of government cheese, and she says that I should not even have a slice.